Now, scientists are, of course, racing to create a vaccine against coronavirus, but we're told not to expect one for many months. So, what do we do in the meantime? Well, some medical professionals believe the BCG vaccine could help. Studies suggest that it boosts the immune system, and a few days ago, a trial started in Australia with healthcare workers taking part. For more on this, I'm joined from London by Dr. Annie Sparrow, Special Advisor to the Director General of the World Health Organization. Hello, thank you very much indeed for your time. Now, as far as I understand, BCG is a vaccine used to prevent tuberculosis. It's been around for decades. So what makes the WHO think that it could help in the battle against COVID-19?
And for a long time, we've known that BCG vaccine, which interestingly enough was actually developed in Paris and first used in 1920-21, so 100 years ago. And we've known that it has these off-target effects. So it protects against the disease actually not very well. We know that. It's not great, but it seems to have a very clear and protective effect against other diseases, and in particular respiratory tract infections. So that we know that trials in adults, for example, giving BCG between 1 and up to 3 doses in the elderly brings the rate of respiratory tract infections and the death rate down by 70 to 80%. So, and there are lots of other effects we've seen where it reduces the death rate in newborn babies by up to 50% in higher risk settings, and even longer term studies done in Denmark where they looked at the effect of smallpox vaccine and BCG vaccine together and saw that the death rate from cancers, from heart disease, from deaths not due to trauma and suicide, for example, was reduced in the long term, which is really staggering. So we really haven't even begun to explore how useful this vaccine could be, but it certainly seems that in terms of protecting vulnerable groups, so that's healthcare workers, the elderly, there's another trial that started in the Netherlands, which is going to look at this effect in both healthcare workers and the elderly, then this vaccine could be incredibly useful in both mitigating the severity of the disease and the death rate, and allowing, healthcare workers either to lessen their off sick, their early return to work, and also, the sheer infection. In Italy and in Spain, more than 5,000 healthcare workers in each country have been infected. In Italy, we know that at least 66 doctors have died, and that's just the doctors. We're not talking about the nurses, which are at huge risk because they're so close. In China, there were thousands of healthcare workers affected, but we don't know because they've never given us clear figures and even covered that up to some extent. So, yes, this vaccine could have extraordinary application, and not just in these groups, but also in continents such as Africa, where there's no way we can bring in the healthcare infrastructure, the healthcare workers. They don't have enough. They just don't have enough healthcare workers, let alone ventilators, oxygen generators. There's not much point bringing in PPE, masks, gowns, gloves when you don't have the healthcare workers to wear them, and you don't even have an environment with basic infection control, bleach, disinfectant, ability to isolate, quarantine, well beyond safe running water, oxygen, and electricity. So there could be an extraordinary applications where we could use this on a population level. And we are very excited to be having started these trials in order to get the evidence to go forward.
When do you think we might have the evidence coming out of Australia? And you mentioned the Netherlands.
Unless it could take. Yes, so certainly because health, certainly in Australia too, it's only just beginning, to take off there. And of course, flu season, this is the, going to be winter, the COVID winter in the Southern Hemisphere. So we expect, the rate of infections to be even higher because people are, living in and working in much more crowded environments. So it's entirely possible that we could start to see trends in real time that couldn't then be applicable to, coming back to winter in the Northern Hemisphere, and that would allow us to think about how we could protect, use this vaccine as a, pandemic protector much more broadly.
Now, despite everything you've told us, you mentioned in an article for Foreign Policy that big global institutions are dawdling. Why is that then, do you think?
Well, I think that speaks also to the lack of examination of this effect before. It's always much sexier to put more money and effort into new vaccines, like we saw with Ebola. And, that's great, but they take a lot of time. And even when we have, these new vaccines, then people aren't necessarily that keen on even taking them. And we saw this effect even with swine flu in 2009. You can have a vaccine, but you can't convince everybody to take it, which is another advantage of using a very old and incredibly safe vaccine that we absolutely know is safe, time and time again. So I think one of the big issues is there's not a lot of money to be made in old vaccines. So, there's a real sort of, there's not much incentive for the pharmaceutical companies to put their, to really invest in it and to push for it. And of course, this is like TB as a vaccine is a disease that hasn't infected the West for decades and decades. So again, I think there's a real lag that reflects our thinking and our lack of ability to think more broadly about how to protect the globe, and instead of just specific populations.
I hope you can get through to more people. Thank you very much indeed. I'm sorry, if you'd like to just finish your sentence.
I just think it's, when there's a clear financial incentive, it's often a lot easier to get everyone behind it. And when but we forget that when we're all healthy, that's an extraordinarily financial incentive for the whole world. We need us all to be healthy in order for our financial system to get back on track, the stock markets. So that is a huge incentive here for them to get behind this also.
Like I said, let's hope that message gets out there. Thank you very much indeed for your time, Dr. Annie Sparrow, joining us there from London.